Michelle. My name is Stephanie, and today we're going to talk about Previsit Planning. One of the things we're going to do is I'm going to give you these cards, and we're going to go through these cards. You can use them as a reference later. So we're going to start with why do we do Previsit Planning. So the first thing is it is a CPC requirement. Function 5 says that we have planned care and population health, and it talks about Previsit Planning as well as morning huddles. It also talks about in our CPC requirements having risk stratification, and Previsit Planning helps us to do that as well. We're going to kind of be prompted to do our risk stratification when we go through our chart review. It also is very vital in identifying trends in labs and vital signs, determining care management needs, and then also determining preventative needs. So when do we do that? Well, we want to do that at least the day before the visit. We can do it a couple of days ahead of time if we need to, but we really don't want to do it much earlier than that. So we have a couple of steps. Our first step is to do a chart review. During our chart review, we want to review the problem list, look at the medication list, the labs and vital signs, our ER and hospital utilization, our trends of appointments, and the last progress note. We want to review and update that risk score if it is indicated. And if they're a high-risk patient, we want to make a note so that we can see them when they come in to see the provider, and also remind ourselves to follow up after that visit with the patient. Okay. Our second step, or kind of breaking down those additional steps, is to look at that problem list. So we want to kind of look at how many chronic problems the patient has, what type of chronic problems the patient has, and this will help us to determine what resources that patient may need. For instance, the patient may need a scale if they have CHF, or supplements if they are malnourished, a glucose monitor if they have diabetes, referral to social services or certified diabetic educators. These are all things we can determine in Previsit Planning. We're also going to look at that medication list. What we're thinking about here are things kind of like, do they need aspirin daily and they're not prescribed that? Do they need to be on a statin? We always want to think about that heart care on our diabetic patients. Maybe they've only been on metformin and their A1C is over 9 and it's been that way for 6 months. This should prompt us to go and talk with the provider and find out what the plan of action is for our patient. Are they on high cost medications when there's generics available? We want to look into that as well. Looking at our latest labs and vital signs, we want to watch for negative upward trends and also those negative downward trends as well. Abnormal and alarming labs, are they due for any labs? Then we want to look at their vital signs. Is there anything we want to pay specific attention to, such as maybe their blood pressure reading was high last time they came in, so we may want to make sure that we let them rest before we take their blood pressure this time, or kind of apply all of the real standard practices for that proper blood pressure taking. We also want to look at that utilization of the hospital and the ER. We want to see how many times has the patient used the ER or has been hospitalized in the past 30 days, 60 days, 90 days, even the past 6 months. This can indicate that there is a care management need. We also want to make sure our EMR is updated to reflect the problem list that was associated with that hospitalization. They may have a new diagnosis now that's not in our EMR, and we will want to make sure we update that or make a note for the provider to update that when they come in. We're also looking at our trends of our appointments. When were they last seen? Is it more than 3 months or 6 months since they were last seen with a chronic condition? How many times have they no-showed, canceled, been late for an appointment? How many specialists do they see? Are the specialists added to the care team? We kind of want to know all of that information. We also want to look at that last progress note. We want to kind of read through it. You want to see, is there anything that was a concern at the last time that they came in for a visit? You want to see if there's anything that needed follow-up before they came in for this visit, such as labs, procedures. Maybe they should have gone to a specialist before they came in. We might need to call our patient before they come in for the visit if there is something such as that. We're going to also look at our health maintenance guidelines. These are preventative measures. So are they due for a preventative measure? Maybe it's a flu shot or a pneumonia shot. Maybe they need their mammogram or their colonoscopy. These are things we can help take care of when they come in for their visit, so we can make note of that. Now, different ways you can do this as far as communicating the information that you found. Some people will write it down and give it to the provider in the MA or LPN. Some people will attend a huddle at the end of the day or mid-morning or even throughout the day with their provider and the healthcare team. But we definitely want to do something to communicate our findings so that that healthcare team, including yourself, can do the best patient care possible. So once we've done all of this, this should help to answer a lot about pre-visit planning. Do you see why it's valuable?
Definitely.
Perfect. Well, why don't we dig into our EMR and do a little practicing at this point, okay?
Okay.
Great.